The 2026 Medicare Advantage changes are more than routine updates. They mark a major shift in payment, performance, and patient care. These updates will directly impact revenue, workflows, and strategy for every organization in the Medicare Advantage space. CMS's goal is clear: improve payment accuracy, raise care quality, and advance health equity. Everyone from coders to executives must adapt, requiring new training, technology, and a focus on comprehensive data. The changes will reshape how providers care for patients, especially those with complex needs or social barriers. New payment models and quality metrics will push for a more holistic, patient-centered approach. This script will break down the financial impact, the new V28 Risk Adjustment Model, and evolving star ratings. By the end, you'll know what's coming, and why early preparation is essential. CMS has finalized a 3.7% average payment increase for Medicare Advantage in 2026, translating to over $16 billion in new revenue. But this average masks important details. Regional cost differences and plan-specific factors mean the impact will vary widely. The effective growth rate set at 2.44%, and other adjustments like coding trends and star ratings all factor into final payments. Organizations must analyze their own markets to understand the real impact and adjust strategies accordingly. Rising healthcare costs and new compliance demands may offset the revenue boost, so a holistic financial plan is critical. Success in 2026 means looking beyond the headline number and preparing for both new revenue and new costs. The full rollout of CMS HCC Risk Adjustment Model V28 in 2026 is a game-changer for plan payments. V28 changes how diagnoses are grouped and weighted, impacting reimbursement and requiring updated clinical documentation. Risk scores will now be based entirely on encounter data, no more chart review submissions. This makes accurate, timely data entry and validation more important than ever. Errors will directly cut into revenue. V28 also removes thousands of less specific diagnosis codes, so coding teams must retrain to capture all relevant conditions. Organizations need to invest in education, upgrade data systems, and audit workflows now to avoid compliance and financial risks. The transition to V28 is not optional. Those who don't adapt will fall behind. Preparation today is the only way to ensure accurate risk scores and stable revenue tomorrow. Star ratings are getting tougher in 2026, with new measures and a sharper focus on health equity. The new Health Equity Index will reward plans that deliver high-quality care to members with social risk factors. Collecting and using social determinants of health data, like housing or food insecurity, will be key to success. Plans must invest in analytics, culturally competent care, and community partnerships to meet these new standards. Excelling in star ratings now means proving you deliver equitable care, not just clinical excellence. Those who adapt will secure bonus payments and stand out in a competitive market. The 2026 Medicare Advantage changes demand immediate, coordinated action, not last-minute fixes. Transitioning to 100% encounter data and the new V28 model requires training, technology upgrades, and process overhauls. Delaying preparation risks revenue loss and operational chaos. Embracing health equity means building new partnerships, integrating social needs screening, and using data for targeted care. These efforts will boost star ratings and improve patient outcomes. The organizations that start now, investing in people, processes, and technology, will lead the way. The 2026 updates are both a challenge and an opportunity. Turning knowledge into action is what will separate the leaders from the laggards in Medicare Advantage.